So welcome everyone. Welcome to our Friend Health Lunch and Learn series. I am Karen Jimenez, one of the community outreach specialists at Friend Health. April is STD Awareness Month. So this month we're going to be talking about STDs, awareness, information. We're going to have our provider, Kimberly Knox O'Shields, discuss about this topic. We're also going to have time for Q&A or questions and answers, and then we're going to have our closing remarks. Just some house rules or ground rules before we move. Make sure that everyone is muted. Questions will be at the end. No drawing on the screens. We had that problem before. Then you also have to stay until the end to participate in the raffle. We're going to have a raffle. And this is a safe environment, so please be respectful of everyone. And if you go to the next slide, please. So Friend Health. We are Friend Health. All patients are welcome at Friend Health, regardless of their ability to pay. We accept all type of health insurance from Medicaid, Medicare, as well as commercial insurance. We also offer a sliding scale fee program to our patients who are underinsured or don't have any health insurance. And their eligibility is based on their household size and income. Next slide, please. Some of the services that Friend Health provides is adult medicine, behavioral health, infectious disease, OBGYN, pediatric care, psychiatry, dental services. Other services and programs that we also have is care coordination, social services, health insurance enrollment. We also have WIC. All of our clinics have laboratory services, and we also have translation and interpretation services and substance abuse disorder services. Next slide, please. Friend Health also have dental services. So our dentists and hygienists offer preventative and additional dental services at our Western location and Pulaski location. Some of the services that we offer are exams, x-rays, cleanings, fluoride, sealants, and oral health education. Next slide, please. So these are all locations that Friend Health has. We have 5 mainly clinic locations. We also have another one at a senior center location. If you need to schedule an appointment, you could call our main number, which is the 773-702-0660. Next slide, please. So welcome to Behavioral Health Integrated Services. Friend Health has an integrated behavioral health services. And what that means, next slide, please. What that means that integrative healthcare teams provide active referrals for services that might be the results of substance use or misuse, anxiety, sadness, and other behavioral concerns. Next slide. So HRDI is a subsidiary of Friend Health. We merge with HRDI, and their intake department, it is located on the corner of 115th Street and Indiana. They offer a wide range of services. For their intake, you would have to go to the location, or you can call their main number, which is the 312-441-9009. And they are actually open 24 hours, 7 days a week. Next slide. Okay, so HRDI, like as I mentioned, it's a subsidiary of Friend Health, and they provide community behavioral health. It's a community behavioral health center that provides a range of prevention, intervention, and treatment health services to address various mental health, substance use, misuse, and community health concerns. They provide 13 additional programs and services addressing but not limited to sadness, anxiety, substance use, misuse, conduct disorders, medication management. So if you or a loved one needs help, you could always call their main number. Again, that number is 312-441-9009. Next slide, please. So HRDI has as well 6 locations throughout the city. Their main location or intake or triage center is the one located on the 115th Street, as I mentioned, but they also have all different centers and different services that they offer each one. But if you wanted for the intake, we recommend to go to the main one. For the intake and assessments, crisis and non-crisis adult counseling also have that in there, and they can refer you to the right location for the needs that you are. Next slide, please. So as I mentioned, insurance that we accept is all patients are welcome, regardless of their ability to pay. So we do accept Medicaid, private insurance, commercial insurance. Aside from that, we offer the sliding scale free program for individuals who are uninsured or uninsured. And the only thing that you will need for that to be screened is usually your photo ID, income, and your address. Next slide. Again, my name is Karen Jimenez. I'm one of the community outreach specialists at Friend Health. These are our, my location is usually Pulaski, but we also have two co-workers with that are part of the team, Conrad Gilbert and James Corbett. So if you have a pen and paper, you can write down our information in case you are in need of any services. Okay, so that is all for our information on Friend Health. We're gonna move on to our main speaker and presentation. So we're gonna be discussing STD awareness. So let me pull that up for you. Once Tony gives me access. Okay, just give my computer a second. Can you see that? James, can you see that? Okay, I think everybody can see. All right, so before we move on, let me introduce our nurse, Knox O'Shields. She is actually one of our providers here at Friend Health. So she is one of our women's health providers at Friend Health. She offers comprehensive women's health care and family planning services. Prior to joining Friend Health, Nurse Knox O'Shields, she worked at the University of Chicago Medicine, and she offers more than 25 years of clinical experience. Ms. Knox O'Shields, she also holds a Bachelor of Science in Nursing from Florida A&M University and a Master's of Science in Nursing from DePaul University. So if you are a patient of ours, you know that Nurse Knox is usually located at our Woodland location. So without further ado, I'm gonna let Nurse Knox go and start her presentation. And everyone can see this, correct?
Good afternoon, everyone. Hello, and welcome to our friend family lunch and learn on STDs. So get the lowdown on what can happen down below. So STDs. I would like to start out by welcoming everyone to our program today. I'm sure there are a lot of my patients on, and I'm excited about that. A lot of our colleagues, and a lot of our family and friends. So welcome once again. So I'd like to start out by posing a couple of questions, and I will ask you these questions again at the end of the presentation. So I'm giving you a little sneak peek. And like I said, we will ask these questions again at the end, and maybe someone can win a raffle or two. So do only teens get STDs? Okay, or can you get an STD from a toilet seat? Can senior citizens get STDs? Can you spread herpes when you don't have an outbreak? Can you get STDs from having oral sex? If you have a lot of STDs, does this increase your chances of getting HIV? Can you get STDs when you're pregnant? Can STDs cause a miscarriage? If I have an STD and I get treated, do I need to tell my partner? And if I tell my partner, does my partner also need to be treated? Is bacterial vaginosis an STD? And can only a female get an STD from a male, or can you also get an STD from same-sex relationships, or can you get STD from any sex toys? So those are just a couple of the questions I want you to kind of pay attention to today. And so we'll start our presentation. So this is a myth. So we're doing some myth busting today. Only trashy people get STDs. So can you go back to the other screen? The next slide, please. If your partner has an STD, will you see it? So going back to number one, so rich people get STDs, poor people get STDs, athletes, math geeks, CEOs, professors. You can get an STD when you have intercourse for the first time, and also teens get STDs, senior citizens get STDs. We treat patients from an OB-GYN from 12 all the way up to probably 80s. And I've seen females as early as 12 to have an STD and as late as 81, believe it or not. So yes, we're all subjected to STDs. If your partner has an STD, you'll see it, not all of the time. So sometimes you can see discharge, but you may or may not know if your partner has an STD until you come to the Friend Health Center and get tested. Yes. If you can you avoid STDs by having oral or anal sex? So the viruses or bacteria that cause STDs can enter the body through tiny cuts or tears through the mouth as well as the genitalia. Some STDs like herpes are genital warts, and some people can get infected just with skin-to-skin contact. All right, once you've had an STD, there's no chance that you'll get one again. And that is so false. Like, I wish that were the truth, but unfortunately, some STDs lately, they are harder to treat. So the CDC recently, I would say at the end of last year, they increased the dosing for the treatment for gonorrhea. Because of that, and also trichomonas is becoming a lot harder to treat. So what makes it very hard is when we go back to the same partner and the partner has not been treated themselves. So a lot of times that goes back to the question I asked, if you have an STD and you're treated, do you need to tell your partner, and does your partner need to be treated? Yes, your partner definitely needs to be treated as well. We tell patients to refrain from intercourse for a couple of weeks. If you have to have intercourse and you can't wait while you're completing the treatment, we make sure that you wear condoms, please, 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 because this will prevent you from passing the bacteria back and forth. And we also have our patients come back in to get retested to make sure the STD is completely gone. Number 5, if you get checked and your STD is free, your partner does not need to get checked as well. Well, a lot of times we know men do not like to come to the doctor. So they will say, well, you go and if you're okay, then I'm okay. But that's not always the case. And you don't always, unfortunately, know what your partner is doing and who they're doing it with. So it's very important that you take care of you, and you also encourage your partner So we have family practice doctors that take care of men as well, and they can come to Friend Family and get a STD screen themselves. Okay, so you can even bring them here to Woodlawn with you. You can take them to Cottage with you. We do have fast track, and at Woodlawn, Dr. Kidder is more than willing to take care of the male partner. She does it for me all of the time, and that's very, very helpful. And at our other locations, we see men as well. So we encourage men as well as women to come into the Friend Family Health Center and get your STD screens. Okay. So sexually transmitted disease. What are sexually transmitted diseases? So if it's a bacterial sexually transmitted disease, it is curable. That means we'll give you some antibiotics, we will do some STD education, and we'll have you come back in like 3 to 4 weeks, and we will make sure that the STD hopefully is cleared up. If it's viral, then that, unfortunately, there's no cure for it, but we do have treatment options. That does not mean that we can't treat you if it's viral. It is a virus, though, and those are things like herpes and genital warts, also HPV. We have Gardasil that we give up until the age 45 now. And that helps to prevent the HPV virus on our cervix. And that, of course, helps to prevent cervical cancer. And that is why we also do pap smears. But getting back to STDs, you can have genital warts. That is a virus, and herpes 1 and 2 is also a virus. So unfortunately, viruses stay with us for life, but they may or may not appear. So bacterial infections are chlamydia, gonorrhea, syphilis. So those can be cured with antibiotics. Viral, like we said, HPV, herpes, HIV, and hepatitis are viral. Parasitic, of course, pubic lice and also trichomonas. Next slide, please. Chlamydia. Let's talk a little bit more about chlamydia. It's bacterial. Men and women can also get chlamydia. You may have unusual vaginal discharge. You may have pain during urination. You may have pain in the lower abdomen. You may have pain during intercourse. You may have bleeding in between your periods. And some people do not have any symptoms whatsoever. Guys may experience a discharge from the urethra. They may have itching or burning while urinating. And sometimes they have no symptoms whatsoever as well. Chlamydia is curable. And like we said, we give you antibiotics to treat chlamydia. Complications with chlamydia. If it remains untreated, and like I said, it's hard to tell because some people don't have any symptoms at all. So if it remains untreated, you can develop pelvic inflammatory disease, and that's a painful recurring infection of the fallopian tubes, ovaries, and the uterus. You could also, it also puts you at risk for an ectopic pregnancy, and that means a pregnancy, as you see here, in the tubes, in the fallopian tubes. We have a picture of a normal fallopian tube versus a fallopian tube with inflammation. Pelvic inflammatory disease causes excruciating pelvic pain. It is curable with antibiotics. Sometimes we can catch it in the office and treat you with antibiotics, and sometimes patients have to be admitted in the hospital when it's a severe infection. So please, 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 let's pay attention to our bodies. There are temples, and we need to practice good safe sex habits, and also to pay attention if you have any excruciating pain or pain that's unusual, you should go to the emergency room if it's that severe. Next slide, please. Facts on chlamydia. Chlamydia is the most frequently reported bacterial sexually transmitted infection in the United States. It's estimated that 1 in 15 sexually active teens aged 14 through 19 has chlamydia. It's an estimated 3 million infections of chlamydia that occur annually in the United States. That's a lot. And I see a lot of patients with chlamydia. It's very, very common. But what I encourage my patients to do when they do have an STD is to please pay attention, please use condoms, and also to make sure that your partner, if you have an STD, is treated. Okay, next slide, please. And those are just some statistics on chlamydia. Next slide. Gonorrhea. So you may experience burning or pain with urination. Also may experience a yellow or green vaginal discharge, bleeding or in between periods, abdominal pain, pain in the lower back, or pain during intercourse. Burning, guys may also experience burning with urination, a yellow or white, green or discharge coming from the penis, or swollen testicles. Next slide, please. And those are some more stats on gonorrhea. Gonorrhea is curable once again with antibiotics. And like I said, CDC did recommend that the dosage for treating gonorrhea, it was increased at the end of the last year. So that's because it's becoming harder and harder to treat. So we really want to encourage you once again, if you have any abnormal or discolored discharge, come into your provider at the Friend Center and let's get you tested for STDs. Syphilis. Syphilis is also a bacterial STD. The first stage is primary syphilis. You may have a red, firm, and sometimes wet sores that don't hurt. They may appear on the vagina, rectum, penis, or the mouth, and they're called cankers. After a few weeks, the canker will usually disappear. It's not a sign, though, that the disease has gone away. And also, in fact, if the infection hasn't been treated, the disease will continue to get worse. The signs or symptoms just may change. Next slide, please. Second stage is secondary syphilis. If syphilis hasn't been treated yet, the person will often break out in a rash, especially on the soles of the feet, the palms of the hands. You may also notice flu-like symptoms. You may have a rash. There's pictures here of the rash on the soles of the feet and the palms of the hands. Hopefully you will notice this before it gets to this point. Next slide, please. Latent syphilis. If syphilis still hasn't been treated yet, a person will have a period of an illness called latent or hidden syphilis. This means that all the signs of the disease go away, but the disease is still very much there. Syphilis can remain hidden for up to 30 years. Third stage or tertiary syphilis, they spread all over the body, including the brain, the heart, spinal cord, eyes, and bones. Symptoms of late syphilis can include difficulty walking, numbness, gradual blindness, and the possibility of even death. And that's, of course, if it remains untreated. So syphilis rates in the United States are they have decreased significantly since the early 1940s. However, we still see patients with syphilis, and we encourage you, as well as your partners, to get treated. And syphilis is also treated with antibiotics, usually penicillin. And of course, that's a series of 3 shots usually. Human papillomavirus. So you may see a lot of commercials advertising Gardasil, and Gardasil is a vaccine that's out, and it helps to prevent the HPV virus. It can be given as early as 10 years old, 10 or 11 at the pediatrics office. We do offer it at Friends. Our pediatricians also give it to their patients. And it can be given as late as age 45. The human papillomavirus can also present in the form of genital warts. The warts can appear on or next to the vagina, cervix, penis, or anus. Can be white or flesh colored, flat, or bumpy. Usually they have little ridges on them. And I usually tell patients if you notice some bumps in your vaginal or rectal area and they're rigid and have bumps, I'm sorry, like a jagged edge, you should come in so we can get you all checked out. Sometimes people have warts and they never notice anything. There's no cure, remember, because this is a virus, but we can use antibiotics. There's an Imiquoid cream that we put on to kind of slough them off or burn them off. Um, Dermatologists also offer laser therapy, and that's chemical freezing as well. Next slide, please. Next slide, please. And so there are some stats on HPV. Alrighty. Complications with HPV, cervical cancer. So HPV is the main cause of cervical cancer. All women are at risk for cervical cancer. It occurs most often in women over the age of 30. Each year, about 12,000 women in the United States get cervical cancer. So very important, ladies, that you talk to your provider about getting a Gardasil. And no, it does not prevent. I saw a question that popped up in the chat, and that was an excellent question. And she wanted to know if Gardasil prevented HPV 100%. And unfortunately, no, it does not. So we still want you to use condoms and to also make sure you get your Gardasil vaccine. So number 2 is vulvar, vaginal, penile, and anal cancer. So HPV will also increase your risk of those cancers as well. So we would once again want to promote you to get your Gardasil vaccines. Next slide, please. HPV facts. Approximately 79 million Americans are currently infected with HPV, and that is a lot. About 14 million people become newly infected each year. So let's be careful. So this is a little a little meme, even though having an STD is never funny. So he said, I think I gave you an STD, and she says, oh my God, I don't know which one. And so he said Hogwarts, but yes, no, HPV and genital warts is no laughing matter. Neither is having an STD. Next slide, please. Herpes simplex 1 and 2. So we get a lot of questions about herpes. It's kind of confusing. It's a confusing topic. And when you come in for a routine STD screen, it does not usually include testing for herpes virus. And that is because most of the time, patients come in with specific complaints. They'll say that I have a blister or a sore, or I feel like a cut in my vaginal or rectal area. And a lot of times that is when we test patients for herpes. Um, Sometimes you may notice the blisters occur like on your thighs. They may also occur on your buttocks. So they may not be specifically located on your vagina or your rectum. So you just have to really be careful. What causes herpes is a general illness, and some people will get fatigue. Some people experience an outbreak when they're really stressed out, and you can also, yes, get herpes through oral sex, definitely. Next slide. Herpes simplex 2, what does it look like? So it may be itchy, it may be red. Sometimes it looks like a bump, like a hair bump. I have a lot of patients that come in and they say, I think I have a hair bump, Nurse Knox. And I'm like, well, let's check it out. And I'm like, is it very painful? So I ask the patients to describe it. A lot of patients think that it's oftentimes a bug bite or a rash. Sometimes it really burns when you urinate. Some patients complain of severe tenderness to the area. Some people complain of pain with intercourse if the area is exposed to friction. And treatment, well, there's no cure, but there is treatment. So we use antiviral meds, Valtrex or Valcyclovir, to treat herpes simplex 2, which is genital herpes. Herpes simplex 1 is like a cold sore on your mouth. And most of the times that comes and goes. Herpes is very, very common in the United States. It's probably about 1 in 6 people that have herpes. So that is a lot. So if you count 1, 2, 3, 4, 5, 6, 1, 2, 3, 4, 5, 6, probably every 6th person has herpes and probably does not know it. When we worry about herpes, of course, it's when you get an outbreak. So that is usually the time that we test you once again for herpes. Not until then. We do not test every patient, like I said, with the STD screen for herpes. Next slide, please. And some more stats. Next slide. Hepatitis A, we're not really going to go into that. We can skip that slide. Trichomonas. So trichomonas is another very common STD. Very, very common. A lot of patients sometimes only hear about chlamydia, gonorrhea, but not trichomonas until they get it. And a lot of patients are like, what in the world is that? So trichomonas is unfortunately a parasite. And usually about 70% of infected people do not know that they have trichomonas because they don't experience any signs or symptoms. Um, Sometimes men will have itching or irritation inside the penis. They may have burning after urination or ejaculation, and sometimes some discharge from the penis. Women may have itching, burning, redness, soreness of the genitals. Some people complain that they feel swollen, especially after intercourse. They may say that they feel like their labia is swollen. Some patients experience burning with urination and may think that they have a urinary tract infection. Some of my patients have a yellowish or greenish, very foul smelling discharge that may sometimes be confused with bacterial vaginosis. Um, and so that's why we encourage you, if you have an odd colored vaginal discharge, to please, please, please come in and let's get you tested for STDs. Next slide. So trichomonas, trichomoniasis, yes, it's hard to spell, but it's definitely easy to catch. Half of all STDs occur in people 25 years of age or younger, but like I said, we have patients of all ages that can get STDs. So this is a stat, but it's a myth because middle-aged patients can get STDs as well as senior citizens as well. I have a lot of senior citizens that come in with a discharge and they think maybe they have a yeast or a bacterial infection, and is sometimes, unfortunately, trichomonas as well. So trichomonas does not discriminate. Next slide, please. Oh, please, next slide. So this was just a little cartoon. I hate to break it to you, but cooties do exist, and it's just when you grow up, they're called STDs. So yes, so these are adult cooties, and we don't want them, but if we get them, they are treatable, most of them. And we like to encourage you once again to come into your nearest friend family location so you can get tested for STDs. Next slide, please. And then here's a list of our several different locations, and hopefully there's one near you. And if not, you can always call and get directions to the one that's closest to your location. Next slide. I think this concludes most of the presentation. I think we're going to take some questions now. And hopefully we've answered all of your questions that we went over in the beginning of the presentation, as well as any questions that you may have had on your own. Okay, back to you, Karen.
Okay, sorry, I had trouble unmuting. So I think I saw a question on the chat box. So if you have any questions, please write it on the chat box and I'm gonna find it. I think someone said, oh, Nasinia, she asked, should I get vaccinated for HPV even though I'm over the age of 50? And then if we can mute Nurse Max, please.
So unfortunately, the CDC recommends that we only vaccinate up to age 45. Yes. So hopefully you by now you don't have a history of HPV, but if you do, it would appear on your pap smear. So when you get your annual exam, um, we can talk to your provider about screening you as well. That's how we screen for HPV is on your pap smear. So hopefully I answered your question. Okay, does anyone else have any questions?
Sorry, we keep on muting me. Another question was, is the HPV vaccine 100% effective?
Yes, so I went over that in the presentation. So unfortunately, it's not 100%, but it does help decrease your chances of getting the HPV virus. And there are a lot of different types of HPV. I didn't go into that because that's a whole subject on its own. But there are a lot of different types, but it does help prevent the types that cause cervical cancer. And that's what's really, really important. So if you get your annual pap smears, they're actually every 3 years until age 30, and then every 5 years after 30 if you've never had an abnormal pap smear. And that is how we screen for HPV once again. So yes, if you have any like very specific questions about your history or if you've ever had HPV, then I suggest that you talk to your OB/GYN provider.
Okay, and then we have another question. It says, do I have to take virus meds every day for the rest of your life? And say if you have one, what do you have to
I'm
do?
sorry, I didn't hear you. You
It
said, do
says,
you have to
do you
take what?
no, the virus meds every day for the rest of your life. So let's say you have an
Oh
STD.
no, if you have herpes, no. So that's a good question. So we recommend that you take the medication whenever you're experiencing an outbreak. I mean, usually that's what most patients do. I do have some patients that have frequent outbreaks and they do take the medicine every day, but most patients take it only when they're experiencing an outbreak.
Now, another question that we have is, does having low or high red blood cell count and white blood cell count means you might have a risk of having HIV?
Now, HIV, you're at risk for HIV anytime you have unprotected intercourse. So we encourage you to wear condoms. You're also at risk for HIV when you have excessive amounts of sexually transmitted infections. So we want to encourage you to try to prevent STDs as much as possible. Um, yes.
Okay, and then one more question I have. Should women over 65 get an annual pelvic exam if not sexually active?
So actually, we stopped performing pap smears at 65, but we still encourage women to come in to get your annual, yes, pelvic exam.
Okay,
Yes. Uh-huh.
let me see. I think that's all the questions that we have. Is there any last minute questions so we can move on into the raffle? I think someone put it. There's one that said, I had a hysterectomy. Did I say that? At 21, do I still need to get a pap smear?
So yes, you should come in to be evaluated. You should still get your annual gynae exams every year, and then your gynecologist, OB-GYN, or a nurse practitioner or midwife will evaluate you to see if you have a cervix and if you need a pap smear. So yes, you still need to come in and get your exam. So very good question.
And then we had just a question. It says, like, I guess we skipped the hepatitis A slide. They were just wondering why did we skip it, or was it out of place?
Because hepatitis A, B, and C, we skipped that because we were just mainly focusing on gonorrhea, chlamydia, trichomonas, and syphilis and herpes.
Okay.
Because of the time frame,
Yeah,
mostly.
no, we're
We
in that
have
time
time
frame.
to go into all of that. Yes. But those are also sexually transmitted. So just please, please, please be careful. Very important.
Okay,
Yes.
so one last question before we move on to the raffle. So we have a patient that she was told that she had trick, but the nurse never encouraged to have a husband tested or treated. What could they do
Okay.
in that situation?
Yes, so most of the time we really encourage patients to get their partners treated and always to get them tested as well. So yes, and I know most providers will even ask if you would like for your partner to be treated. In Illinois, it is legal for you to have your partners treated as well. I encourage my patients to have them tested to make sure because they may have more than just trichomonas. So I encourage them, my patients to bring their partners in to family medicine to be checked. If it's a female partner, of course, you would also encourage her as well to come in and be evaluated for STDs. But we have family practice and they take care of men. We take care of men, women, children. We take care of all of your family and your friends. So, yes, we encourage you to bring them in to be tested for STDs.
Okay, okay. So I think we're all set with the Q&A section. Just want to say thank you, Nurse Max, for
Thank
being available
you.
to
I
us.
hope I answered everyone's questions today, and I hope you, received a lot of information or some information that you may not have known about. And if you have any further questions, then please feel free to come in, and we will answer all of your questions and take excellent care of you.
Yes, definitely. So if you
You.
guys are not patients of ours, just know that Nurse Max is actually located on our Woodlawn location. And if you go back to the slide, Tony, do we have the slide on the other locations?
We also have, like I said, we have a lot of excellent family practice doctors. We have a lot of excellent pediatricians. We have a lot of excellent OB-GYN doctors, midwives, nurse practitioners as well, PAs that will help take excellent care of you.
Yeah, so this is our main number. You could always call our main number, which is 773-702-0660. In case you are in need of any health insurance enrollment assistance, or you just need a contact to get sooner to the clinic, you could always contact any of the outreach specialists workers here at Friend Health, so I'm one of them. You can write down my name. It's Karen Jimenez, and my number is 312-307-2525, as well as my co-workers, James Corbett. His number is 312, hold on, I'm looking for it, guys. 312-989-5995. And then also have Conrad's number. His number is 312-863-0660.